How to choose toothpaste for your child. My name is Dr. Olga Dolghier. I'm a board-certified pediatric dentist at Palm Valley Pediatric Dentistry and orthodontics. So we get this question a lot. There's so many different brands. Moms are overwhelmed, kids don't want to brush, they don't like the taste. How can I help? So let's decide what toothpaste you should use for your child. Number one, look at the package. Make sure that it has ADA sealed special stamp on it. That way you know it's American Academy of Dentistry approved. So because we know that means that that toothpaste is actually FDA approved and that toothpaste works. Which toothpaste we know work well to protect your kids' teeth from cavities and which we're not sure about. So we know historically that toothpaste with fluoride is beneficial. It's proven by multiple research studies, is accepted by American Academy of Pediatric Dentistry, American Dental Association. That is extremely important to know it has fluoride in it. Now, new recommendations are we're using toothpaste regardless of child's age. So we get this question a lot. Mom comes in for the first visit with a child who's barely one and they're not using toothpaste yet. So new guidelines, attention, new guidelines. So we want to use toothpaste with fluoride regardless of your child's age. But size matters. So for babies, you're gonna put just a smear. When your child learns how to spit out, we can use pea size. So we're switching size of the grain of rice to pea size after the age of 3, or when your child is actually can spit toothpaste out. Because you know fluoride is a medicine. We don't want to get too much fluoride either. We just want the right amount to protect your kids from getting cavities. What about brands? There's so many different brands. Dr. Olga, what about natural toothpaste? What about new type of calcium-based toothpaste, calcium phosphate toothpaste? So again, fluoride, we know it's 100% proven that it works. All the other ones, we're still researching. It doesn't mean that they're bad for you, but they are not FDA approved, not American Dental Association approved. So we're still learning and researching, so we don't have backup to tell you if you don't have toothpaste with fluoride, it works as good as one with fluoride. Mom asking me, what about xylitol? Xylitol is great, but you have to chew so much xylitol gums or use so much xylitol, so it actually disturbs the lining of your stomach and kids get upset stomach. So it's kind of a fine line, what is good, what is bad. So we know fluoride is good in kids' toothpaste. Brands. So there is traditional brands, your Colgate for kids toothpaste, your Crest toothpaste for kids, also Burt's Bees toothpaste for kids, Tom's of Maine. And Tom's of Maine, you have to look at the label because some of them have no fluoride. Tom's of Maine is one of my favorite ones. I just like the flavor. It's called Silly Strawberry. Some parents asking me, Dr. Olga, what about my toothpaste? I'm an adult, what's the difference? Really, there's not that much difference. So if you look at back side of the toothpaste, and I have two samples here, this is adult, this is kids. So when you look at the box, look for active ingredients. So if you look at the ingredients here, they actually have the same concentration of fluoride on both of them, and you cannot tell the difference. What difference is other ingredients. So fluoride is absolutely the same concentration. So this is kids and adults, same concentration of fluoride. Other ingredients are different. Pediatric toothpaste and adult toothpaste concentration of fluoride is the same. The other inactive ingredients are different. So you have to be mindful of that, because if you're getting toothpaste from Colgate, which is tartar control or bleaching toothpaste, it would have additional chemicals which might not be beneficial for your little one. So use toothpaste according to the label. If it's a kid's toothpaste, use kids toothpaste. If it's adult toothpaste, use adult toothpaste. So active ingredients is the same, but the other ones, which inactive ingredients, are very, very different. So if you can look at the label, you definitely can determine that there is some differences between. What about other brands? So there is new brands coming out which has other ingredients which don't have fluoride. They call natural toothpaste, non-fluoride toothpaste. As again, be mindful of your risk. If you have high-risk child who gets cavities every 6 months, the golden standard is fluoride. So we want that fluoride. If your child don't get cavities often, you never had cavities in your whole life, you can have different toothpaste. If you're concerned about fluoride and so on, you can have non-fluoridated toothpaste. But it's all a matter of the risk. If high risk, fluoride must, 100% all the time. If you're low risk, then you might have wiggle room around non-fluoridated toothpaste. So I hope I answered the question about what toothpaste should you choose. Look at the labels, make sure it has fluoride, make sure it's tailored for children. And also kids have sensitive taste buds on their tongue, much more sensitive than ours. Your mint toothpaste may taste bitter or spicy for your little one. So that's why most of the kids toothpaste, they have bubblegum flavor or silly strawberry flavor or other kids-friendly flavors, which are usually sweet. And a lot of parents ask me this question, Dr. Olga, I don't like that kids toothpaste tastes sweet. But you don't, but your child probably does, okay? Because they have different perception of taste. Their taste is much more strong. They can taste different flavors better than you do. So it's a good idea to stick probably with the kids version again. If they do like mint, absolutely try mint, but a lot of times mint tastes spicy for them. So that all matter. So make your selections, make your decisions based on the labels, based on your doctor recommendation, and have the best toothpaste for your child. Can you share with me what toothpaste do you use for your little ones? What toothpaste they like, what toothpaste they don't like? Share below, let me know, and I'll answer all your questions and other videos about toothpaste. That's how we do it at Palm Valley Pediatric Dentistry and Orthodontics.